A gigantic investment into pediatric care is coming to Louisville's East End. Norton Healthcare announced it will build a new children's medical campus on 150 acres of land near the Snyder and I-64. Development will start with the construction of a hospital on Tucker Station Road. Officials say they plan to expand to behavioral and mental health care, a clinic space, and research facilities.
Norton Healthcare President and CEO Russell Cox joins us now live. And Russell, this isn't just big news for Norton and for Louisville, but for children's health care in our area.
You're absolutely right, Hayden. And we're really excited about this concept. We don't think there's a place like this anywhere in the country. When you have 150 acres, you have an opportunity to dedicate it to everything that has to do with pediatric families, and especially those patients. And we want to do it in a way that is contemporary, that looks into the future, that really takes the consideration of what a family needs when they have a child in the hospital into account. And we're going to do a lot of listening. We're going to talk to a lot of patients, a lot of parents throughout the region, not just Louisville or the state, but the entire region, because it's a great opportunity to redefine how pediatric care is delivered.
Russ, you said that the hospital will be built first and then other services will follow. Can you give us a timeline of what this project looks like to be fully complete?
Absolutely, Gil. It's one of those things. We learned so much from Norton West Louisville Hospital by going out first and having listening sessions and asking questions about how people would like to have care delivered, what things build trust, how do we go about structuring a facility, what things would you like to see, what services. So we're going to take the next year. We're going to get in the van, the Just for Kids van. We're going to go everywhere we can imagine in the region, and we're going to have meetings. We're going to talk to physicians. We're going to talk to parents. We're going to talk to kids. We're going to talk to community leaders, and we're going to ask the questions about what they would like to see, because we think that being in Louisville, Kentucky, right there on I-64, is a great place for people throughout the region to come. And let me also say that on this 150 acres, we want it to be a place where when families come, they don't ever have to leave unless it's time for them to go back home. We want this to be a coordinated care sort of pediatric campus, but it also have the amenities that families need. We know for certain that outcomes improve when families are involved with the pediatric patient. It can be close and be without stress. So I envision this having hotels, restaurants. I envision it having fitness centers. I envision it having everything that families need in order to feel very comfortable while their child is getting the much needed care that they're going to need. But I'm also excited about the fact that we're finally going to do something that I think is going to really help from a behavioral health perspective. For too long, so many of our children are suffering from anxiety and ADHD and so many other type things. And we have an opportunity to build that into our programming and to become very much known in the country for behavioral health. So we're excited about the opportunities, but we want to hear what people have to say. Once we have that, we'll take a look at it all, and then we'll start meeting with architects and start meeting with designers. We've got almost like a little city out there in J-Town. 150 acres is significant, gives you an opportunity to paint a new picture.
Indeed it is. There was a lot of expansion happening for Norton, it seems, in a very short period of time. The successful launch of the West Louisville Hospital, you acquired some hospitals in southern Indiana. Can you kind of walk us through that, and how does that expansion align with shifts in what may change with Medicare, Medicaid, and federal funding?
Well, it's a great question, Gil. And one of the things that I'll tell you is Norton Healthcare has been around for over 140 years. So there's a legacy of care here. But over the last 10 years, we've really looked at providing access to all parts of the community as the true north of our mission. We believe that if we provide access that people can trust, that people find convenient to go to, where we can remove the barriers for them to get there and to get care, that we can improve those outcomes. As you heard me say so many times during Norton West Louisville Hospital, for our community to have a 12-mile span of life expectancy that is a difference of 15 years is unconscionable. And what that says is that we haven't had access in a level playing field sort of way in our community for way too many years. So our strategy has been to let's get as many places where we can provide quality access to everybody in a community. And that's the way that we're going to begin to turn those statistics. We're a not-for-profit healthcare organization. Our goal is to make it a better place for this community to live, but for everybody to have an equal opportunity to get the services that they need. If you look at Norton West Louisville Hospital, we've already seen thousands of folks that had never been to a hospital before. So We think that the pediatric version of what we're doing is going to provide a different level of access to people throughout the region. We want this to be a place that puts Louisville on the map. I've always believed that Louisville's healthcare DNA was so strong. We shouldn't take a backseat to Nashville, to Cincinnati, to anywhere. We should build things. We should develop things like this where people in other parts of the country say, I want to go to Louisville.
A lot of people excited to be able to get that care here finally for their kids. Thanks for your time today, Russell.
Thank you, and happy Father's Day, Gil.
Oh, thank you so much. Same to you.